Good morning to all. Today we'll be discussing on chronic renal failure. So chronic kidney disease, also known as CKD or chronic renal disease, it is a rapidly progressive deterioration or loss of renal function in which the body's ability to maintain metabolic and fluid and electrolyte balance fails, resulting in uremia or azotemia. That means they will be progressive. That is, there will be slow and progressive deterioration. That means there will be decrease in the function or loss of the renal function in which the body's ability to maintain the metabolic and fluid and electrolyte imbalance and metabolic imbalance will be lost because the person's kidney function will not be doing. Then it will lead in what? It will lead in uremia and azotemia. Uremia means there will be high levels of waste products in the urine, which will not be normally present. Then in azotemia, what will happen? High number of nitrogenous waste will be present in the urine. So these are the two main terms which will be mainly present in the chronic renal failure. This will occur over a period of months or years. Chronic means for a long period of time. So it will be present over a month or in terms of months or years. This is characterized by slow, insidious, and irreversible. Slow, it will be slow in progress, slow and progressive. Then insidious, that means it will be dangerous and harmful. And then irreversible, that means it will not be able to come back to its normal function again. There will be impairment of renal excretory and regulatory functions. That means to regulation of urine production will be lost, and also the excretory function means to extract the urine out of the body. That function will be lost. That is, the person will be having low urine output. Then next is the etiology and risk factor. If the person is having family history of kidney disease, then he is at risk. Then if the person is having chronic glomerulonephritis, that is inflammation of the glomeruli. Then next is if the person is having diabetes mellitus or high blood pressure. Then long-term infections such as chronic pyelonephritis, is the infection of the kidney, and tuberculosis, that you know. Then polycystic kidney disease, that means large number of cysts will be present in the kidney. If the person is having the polycystic kidney disease, then he is at risk of developing this chronic renal failure also. Then nephrotoxic agents like long-term use of aminoglycoside therapy. Aminoglycosides, I've already told, it is a type of antibiotic. Then its main side effect is ototoxic and nephrotoxic effects. Ototoxic means in the ear, it will be affecting. Then nephrotoxic means in the kidney. So if the person is having the long-term use of this aminoglycoside, then he or she will be having nephrotoxic effect. So automatically he will develop the renal failures. Okay. Then next is autoimmune disorders such as systemic lupus erythematosus and scleroderma. Okay. Then if the person is having injury or trauma to the kidneys, kidney stones, then reflux nephropathy. Reflux nephropathy means backflow of the urine from the bladder to the kidneys. Okay, then certain toxic chemicals like cadmium and mercury. So these all are the etiology and risk factors of chronic renal failure. Then next comes to the pathophysiology. In pathophysiology, what will happen due to the etiology? In short, I will tell you. Due to the etiological factors, what will happen? The nephron will be damaged. If the nephron is damaged, then there will be decrease in the GFR, that is a glomerular filtration rate. Due to the decrease in GFR, the kidney will not be able to do the filtration, secretion, and all. Then so if there is imbalance in the filtration and secretion and all, then what will happen? The blood will be more concentrated. Okay, the particles, the amount which is to be absorbed by the blood, it will not be absorbed. Then the waste which is to be excreted, which is to be absorbed, will be excreted in the urine, and which is to be excreted in the urine will get accumulated in the blood. So in short, what will happen? There will be abnormal amounts of protein, RBCs, white blood cells in the urine. Then in the blood, what will happen? There will be increased amount of creatinine, BUN, that is blood urea nitrogen, and urea and other nitrogenous waste that will be present in the blood. So the term uremia and azotemia, I've already told you in the definition, uremia and azotemia will be there. These are the main features. Then lastly, what will happen? The nephron will be damaged. Up to 80 to 90% of the nephron will be damaged. Then lastly, will develop to chronic renal failure. The next we'll discuss on the clinical manifestation, that is the signs and symptoms. According to the system wise I've classified. So first is in a neurological system. In a neurological system, there will be cognitive impairment. That is, a person will not be able to remember, difficulty in concentrating will be there. Then personality changes in behavior. Then memory impairment will be there. Then asterisk. That means there will be motor disturbance that affects a group of muscles. Motor means in movement, muscle coordination. So if there is loss of balance in the muscle coordination, then there will be involuntary movement like tremor of the face, feet and all. Then seizures will be there, confusion, inability to concentrate, disorientation, then tremors, restlessness of the legs, that is involuntary movement, then burning of souls and fates and behavior changes. So these all are under the neurological system. Next is the GI system. In the GI system, nausea, vomiting, then mainly food distress will be there because there will be ammonia odor in the breath. Due to this, the person will experience metallic taste in the food. Okay, then mouth ulcerations and bleeding might also be there. Anorexia, loss of appetite, then hiccups, constipation, diarrhea, and bleeding from the GI tract. The next is in the blood forming system will happen anemia, which is due to the erythropoietin deficiency. Okay, then easy bruising and bleeding due to the abnormal platelets and thrombocytopenia. The next is in the pulmonary system, fluid in the lungs with breathing difficulties. Then thick tenacious sputum will be there, and uremic pneumonia, then depressed cough reflex, pleuritic pain. Okay, that is a sharp pain which is mainly present while inhaling and exhaling. So this is known as the pleuritic pain. And shortness of breath will be there. Tachypnea will be there. Tachypnea means increased respiratory rate. Then cosmal style respiration will be there. That means deep labored breathing. The patient will be experiencing labored breathing, not the normal one. Then under the cardiovascular system, chest pain, then pericarditis, that is inflammation of the sac surrounding the heart. Then pericardial effusion, that is a fluid accumulation around the heart. Then hyperkalemia and hyperlipidemia. Hyperkalemia means there will be increased amount of potassium. Okay, the normal potassium level in the blood is 3.5 to 5.5 milliequivalent per liter. Okay, so there will be more than 5.5 milliequivalent per liter in this case. Then hyperlipidemia, more amount of lipid. Then in the skin, there will be generalized itching, that is pruritus. Then gray-brown skin color, dry flaky skin, ecchymosis, that is bluish discoloration of the skin. Purpura, that is rashes. Okay, then spots will be there, and then thin brittle nails, coarse and thick ear. This all will be present under the skin. Then next is the diagnostic evaluations. Under the blood studies, what will happen? And in the signs and symptoms also, we have known that the person will be suffering from anemia. Okay, that is after doing the blood test, they will confirm the low red blood cell count. RBC count will be low. Then there will be high level of parathyroid hormones also. Then hypocalcemia, that is low level of phosphate will be there. Hyperphosphatemia, that is high level of phosphate will be there. Then hyperkalemia, high blood level of potassium. Then hyponatremia, sodium will be low. Then low blood level of bicarbonates and plasma pH. Under imaging studies we can do CT scan, ultrasound. Then we can also do the renal biopsy. In renal biopsy, what will happen? We'll extract a small amount of small tissue from the kidney. Okay, then it will be analyzed for any abnormalities, which may be the exact cause of the chronic kidney failure. Then in the management, we can give medicines like diuretics, phosphate binders, antihypertensive agents, antiemetics. Okay, in the diuretics, what it will do, it will mobilize the fluids that cause edema. So it will decrease edema, and it will it will help in removing the excess water out of the body. Example, furosemide. Okay, then next is the phosphate binders. Like it will treat the renal osteodystrophy by binding the phosphate and supplementary calcium. Okay, example is calcium carbonate. Then antihypertensive agents to control the blood pressure and edema. Then antiemetics to relieve nausea and vomiting. Then ranitidine to decrease the gastric irritation. Then iron and folate supplements can be given to combat to treat the anemia and to combat the hematologic effects of CRF. Then dietary therapy, low protein diet should be given to limit the accumulation of the end products of protein metabolism. Then in the surgery, we can do the kidney transplantation or renal transplantation. Under this, what will happen? Donor and recipient will be there. The donor will be giving the kidney to the recipient, in whom the transplanted kidney can perform all the functions which the patient kidneys are not able to perform. Okay, so nursing diagnosis, under the nursing management, you have to formulate the nursing diagnosis and make a nursing care plan of a patient with chronic renal failure. Okay, this will also be beneficial when you do the nursing care plan, when you write the nursing care plan of the patient with chronic renal failure. If you have any patient, if you have care for any patient who has a chronic renal failure, then you can also refer from that and write the nursing care plan. So these are all about the chronic renal failure. Okay, thank you.